Welcome to the 7th most common causes of back pain and how to overcome them. All 7 steps are described in the text of this program, and 5 out of those 7 steps are emphasized in the video. I'd like to thank Vic for agreeing to help us out here and demonstrate all the exercises, treatments and tests you can do to lessen or remove your back pain yourself. You see V sitting on a Swiss ball here. You need a Swiss ball at one time of the program. You need a lacrosse ball, blood pressure cuff, book, wooden stick, mat and a foam roller. First part of the video and third part of the program is the trigger point treatment. The first muscle is the QL or quadratus lumborum. Please Google QL trigger points and you will see the 4 sites this muscle tends to develop trigger points in. Lie down on your back. Get the lacrosse ball between the lower rib and the top of the pelvis. Pull the leg on the same side across your chest towards the opposite shoulder to open up the gap between the lumbus, between the lower rib and the top of the pelvis, and draw the belly button in to further relax the QL and open up the gap nicely so the ball can penetrate the top layer of back muscles and go into the QL. Explore all 4 common sites for developing trigger points to find out which one of them you have personally and focus on them. You've got to wait 10 to 15 up to 20-25 seconds until the muscle releases and the pain dissipates. It feels pretty good, but at the beginning it will be painful. The second muscle, the gluteus medius, one of the small gluteal muscles. This muscle is situated between the hip joint and the top of your pelvis. It has 3 common sites for trigger points. So with the lacrosse ball, lie down on your back, and the first trigger point, the most common one, is right on the top of the pelvis along the SI joint. Please Google gluteus medius GM trigger points and you'll see where to position the ball exactly. That's very important. Again, 10, 15, 20 seconds until the muscle releases and the pain dissipates. If it doesn't from the first time, back off and try again, and then again eventually the muscle will release. Second trigger point, you need to turn yourself slightly to the side, and with the third trigger point you need to lie down on one side because the trigger point is between the hip joint and the top of the pelvis. With practice and time you will develop your own way that's comfortable for you to position yourself so you access the trigger point, but at the same time you can relax and wait until the muscle releases. This is very important, but again comes with practice. Now the third muscle we're going to address with the trigger point treatment using the lacrosse ball once again is the hip flexor muscles. The hip flexor has 2 portions, one attached to the spine, the other one attached to the top of the pelvis. We're going to work on the one that attaches to the spine first. The trigger point is at the level of the belly button, very close to the belly button, but it's a bottom layer, so we will need to use a book to elevate the lacrosse ball so we can go through the first layer into the second one. The second trigger point is right at the front of your hip. Lie down on the floor in a prone position. The ball is on top of the book and the ball needs to penetrate the first layer, the abdominal layer, abdominal muscles, and go into the hip flexor. It could be quite painful. You need to relax completely on the top of the ball and wait until the muscle releases. Pulling the belly button in really helps. It will be a little more painful, but the muscle will release much quicker. You'll feel the muscle lengthening and the tension across your lower back disappearing, dissipating. Now after that, you'll treat the trigger point at the front of the hip. You wouldn't need the ball, but you can still use it though. In this case, apart from pulling your belly button in, also you can squeeze the butt cheek on the same side. This will additionally release the hip flexor. Makes the treatment quicker and more effective. So you get a stretch and a massage at the same time. Trigger point treatment really. And again, wait 10, 15, 20, 25 seconds. If it doesn't release, back off, try again. Don't make it too painful because again the nervous system will actually refuse to release the muscle if it's too painful. Now we're going to the next part of the video, posture, muscle balance and corrective exercise. Demonstrating here how to figure out for yourself what a neutral spinal alignment is for you. Heels are about 3 inches away from the wall. You lean against the wall, the back of your head, the mid-back and the sacrum, the bottom of your lumbar spine, and a contact with the wall. The neutral spine is when the thickest part of your hand across the base of your thumb sticks along the spine. It gets stuck really. So not your fingers getting stuck, not your wrist, so the hand should not pass through freely, but the thickest part of your own hand getting stuck between the wall and the lumbar spine. This is the neutral alignment for V. Now she draws the belly button in and fixes this spinal alignment. Wait there and get used to it. Another way of identifying the neutral spine is in a 4-point position. Stick on top of your back, the wooden stick, and it's in a contact with the sacrum. You can see it clearly here. Sacrum, mid-back between the shoulder blades and back of your head. V going from flat back to hyper extension, and then going to neutral spinal alignment, and then you hold it, gently draw the belly button in and narrow the waist and hold this position and get the feeling. Again, feel the 3 points of contact and the abdominal engagement. Now with the postural issues, V demonstrates here the upper cross syndrome, shoulders back and down, head forward. And to address this imbalance, I'm getting you the picture there for a few seconds. Rolling the pec minor, which tends to get very tight, one of the small pec muscles, either using the other hand, opposite hand, or against the wall this way. You can do it dynamically, or you can just wait there for the muscle to release. You can position your hand in a different way, flex the elbow, extend the elbow, reach up, reach to the side, different angles. And then you roll the upper trapezius and levator scapula, two of the upper back muscles that tend to pull the shoulder blade up and tilt it forward. You can use the opposite hand again, make sure you keep both shoulders back and down, or you can use the pillar or the wall and kind of flex the hips at 90 degrees and lean into it. This is a very good way to release these muscles, quite comfortable position. And again, wait 10, 15, 20 seconds until the muscle releases. Do this one statically, do not move left and right. And now, since we've lengthened these muscles and released them, we can go into strengthening the opposing muscles, which are the lower trapezius and the external shoulder rotators. They're very important for scapular stability and shoulder health. Lift the hand from a 4-point position at 45-degree angle, and then go into a W position. I call the two positions hitchhiker and W, single arm. You go from 4 to 3-point position, thumb pointing up, the shoulder stays back and down, no shoulder shrugging. And then from a hitchhiker, 45 degree, going into a W, where the shoulder goes nicely back and down. Now I'm demonstrating lower cross syndrome, where you have an excessive lumbar curve. The first thing is you can use the ball, the lacrosse ball, to release the hip flexors. Refer to the first part of the video, the trigger point treatment. Now we're going to the stretching the hip flexor. In this case, the right one, having the left foot forward. You need to tuck your butt under, engaging the right butt cheek, and pull the belly button in, so you're giving your pelvis a posterior tilt. And lean to the opposite side. Keep pulling the belly button in and squeezing your butt cheek, tucking your butt under. Do not arch your back, but tuck your butt under. This will release the hip flexor nicely. Now going into a strengthening exercise now. We're going to strengthen the lower abdominals, which tend to get inhibited and overstretched with the lower cross syndrome. You pull the belly button in, raise your feet up, lying down on your back. Pull the belly button in and tuck your butt under, flattening the lumbar spine, so you can't slide your hand between your back and the floor. Maintaining this abdominal contraction, slowly lower your feet from the hips. As soon as your heels touch the floor, head back up. Do it slowly and keep high muscle tension in the abdominal area. Don't let your back, you must not allow your back to come off the floor with this exercise, very important. Now here, leg length discrepancy. You do a test, lateral flexion, and see if one of the QLs that you're familiar with already, one of the back muscles, is tighter than the other one. If it is, it will pull the hip up and one leg will appear to be shorter. Do this test, and in this case we assume that V has Her left QL tighter than the right one, so the left hip is higher, left leg appears to be shorter. We want to stretch the QL by lying down on the ball and having the left QL and hip on the top so we can stretch them. Have the bottom leg as the leading leg and the top one as the rear leg, feet about hip width apart. Reach up and over and allow the body in one plane to wrap itself around the ball, so you're relaxing the hips on one side of the apex, shoulder girdle and rib cage on the other. Reaching up and over. Change the position of your top arm so you find out what works for you best to get the stretch right here in the QL area at the back. Abdominals pulled in gently, and you can tuck your butt under by squeezing the left butt cheek. This will additionally stretch the QL. And then coming out of position, you can hold it for 10, 15, 20, up to 30 seconds. Now, next stage or next part of the video is reactivation and strengthening of the deep core muscles, which are responsible for spinal stability, the inner unit, the inner unit. Now you have a blood pressure cuff positioned directly under the belly button, lying down on your front, completely relaxed. Pump up the blood pressure cuff, the blood pressure cuff up to 40 millimeters mercury while relaxed. Take a deep breath in, and as you breathe out, pull the belly button away from the blood pressure cuff, so the blood pressure drops down to, the reading drops down to 30 millimeters mercury, and hold it for 10 seconds, maintaining shallow breathing. Keep on practicing with this exercise. Even if you're able to hold it only for a second or two at the beginning, you need to build up to 10 seconds. Now, using the same principle, this time no blood pressure cuff, but you have a string wrapped around your waist and with a neutral spine. Now with the string, I'll show you, it's quite tight now and it digs into V's waist. She can feel it, so the string gives you an immediate feedback. You maintain a neutral spine, you take a deep breath in, and as you breathe out, using the principle of the previous exercise, draw the belly button in, narrow the waist, and the string, you can see now the string gets looser and looser and looser. There you go, and V can barely feel the string around the waist. That means she has engaged the deep abdominal muscles that are responsible for spinal stability, and you hold this position for 10 seconds. You've got to build up to doing 10 repetitions, 10 seconds easily. Maintain the breathing, do not hold your breath in. The next stage, V demonstrates flat back or sway back posture here, and many people struggle with such a postural issue, and to resolve it we need to strengthen, apart from the core muscles, the posterior chain of muscles, the extensor chain of muscles. The first exercise is a supine gluteal bridges or hip extensions. Lie down on your back, hands by your side, palms up, draw the belly button in, and from this position slowly squeeze your butt and raise the pelvis up towards the ceiling. Imagine that someone is pulling your pelvis up towards the ceiling with a string. Hold the top position up to 10 seconds and then release and repeat. The next exercise is using a Swiss ball. It's the same exercise. Flex the knees and the hips and lower your butt down, keeping the back of your head, mid, spine and the sacrum against the ball, and from there raise the hips straight up towards the ceiling. Don't go too fast, do not use momentum. The movement should be slow with high tension. Keep the knees right over your ankles so you can use your butt and extend the hips. Don't push back, push up towards the ceiling. This is great exercise. Next exercise is prone on the top of the Swiss ball. From this position you engage the deep abdominal muscles, and as soon as you take your hands off, you pick your chest off the ball gently and clench your butt, squeezing your big butt muscles, holding the position up to 10 seconds with shallow breathing. As you hold the position, abdominal muscles are engaged, the deep pelvic floor muscles are engaged, your gluteal muscles are engaged, and all the spinal stabilizers and erectors are engaged, together with the shoulder blade stabilizers and external rotators. This is a brilliant exercise. It looks easy, but actually isn't. And the last one, the last exercise for strengthening the posterior chain of muscles, hamstrings, butt and back muscles, is the supine Swiss ball hip extensions, this time with the legs straight and you have an unstable base. Pull the belly button in, hands next to you by your sides, palms facing up. Drive the back of your heels into the ball, keeping the belly button drawn in, and squeeze your butt and raise your hips straight up towards the ceiling once again, holding up to 10 seconds. Use your hands as little as possible. Now this is the routine. Those are the 7 most common causes of back pain and how to overcome them. You've got to do these exercises pretty much every day or every other day. You can do one portion on Monday, next one on Tuesday. You've got to be disciplined. You've got to do them on a regular basis. You've got to create time and do them frequently. This is very, very, very important. You can't expect to do them once a week and get good results. Not possible. Please, if you have any questions, email me at gv@vshapefit.com. I'll be very happy to help you. And the last advice is, if you can find a really good personal trainer or check practitioner to assess your posture and muscle imbalances, that will be also of great help to you. Thank you, and I wish you good luck.